Good afternoon. Welcome to the Senate Committee on Health and Human Services. Madam Secretary, please proceed to call the roll.
Senator Lang. Here. Senator Wynn. Here. Senator Titus. Here. Senator Stone. Here. Chair Donate.
And I am here. All members are present. Thank you so much. Welcome everyone to today's meeting from Senate HHS. Today we will have a work session followed by a hearing on Senate Bill 435. I have made the decision to pull Senate Bill 348 from the work session document. We already work sessioned it yesterday. I am going to make a procedure on the floor when it gets to there, so just giving everyone a heads up. So we will not be discussing that today. I do have a few housekeeping items, as we do for every meeting. For folks that want to testify in support or for any of these bills, we ask that you keep your remarks to 2 minutes each. We also have, for the sake of time, we have allocated only 10 minutes for presentations. We only have one today, so we'll be a little bit flexible if folks have questions, etc. But again, when you testify, if you get cut off after the 2-minute mark, please make sure that you deliver your remarks to the committee staff, and anyone who wishes to receive copies of the committee's exhibits can go to the Nevada Legislature's website. And finally, we ask everyone to please silence their phones and laptops. Let's begin with work session. So we're gonna start with the work session on SB 191. Ms. Cooper, when you're ready.
Destiny Cooper, Research Division, Legislative Counsel Bureau. We'll start with Senate Bill 191. It was heard on April 11th. Senate Bill 191 requires the Director of the Department of Health and Human Services to include in the state plan for Medicaid coverage for the cost of services provided by a behavior analyst, an assistant behavior analyst, and certain behavior technicians. It also increases the application fee for licensure as a behavior analyst or assistant behavior analyst from $100 to a maximum of $550. Please see the amendment attached. Thank you.
Thank you so much. Any questions regarding the amendment?
No.
Vice Chair Nguyen?
I was just going to make a motion to amend and do pass. Or is it just do pass?
This one's amend do pass.
Amend do pass.
We have a motion. We have second
Second.
from Senator Lang. Any discussion? Senator Stone.
Thank you, Mr. Chair. It's been a very busy day with a lot of amendments, and so I was told there was going to be an amendment to have a reduction in the fee from $550 to $450. Was that part of the amendment? Forgive my. Thank you. Then, if I can just make up just a brief comment. The autistic population is a highly underserved area, not only in Nevada, but across the United States. I have a severely affected autistic granddaughter. She's my oldest granddaughter, nonverbal. I'm very concerned for her health and welfare beyond her adult age. This is going to be a strong benefit to many families that have no other alternatives for health care for their autistic children, and that's why I'm so passionate about being for this bill. Thank you.
Thank you so much. Any other comments? Okay, moving on to the vote. Again, this is amend do pass on Senate Bill 191. All those in favor, please say aye. Aye. Any opposition?
Nay.
We have one opposition from Senator Titus. The motion's carried, and I'll go ahead and sign that floor statement to Senator Severs-Ganser. Let's move on to Senate Bill 441. Ms. Cooper.
Destiny Cooper for the record. Senate Bill 441 was heard on April 11th. It eliminates the requirement for the Director of Health and Human Services or certain district boards of health to adopt regulations requiring certain protocols and plans concerning the prevention of and response to the coronavirus disease of 2019. This bill declares any regulations adopted by the Director or the boards pursuant to Senate Bill 4 of the 32nd special session void, however, does not apply to any claims filed for the failure to comply before the effective date of these provisions. Thank you.
Thank you so much, Ms. Cooper. Really quickly on this bill, I think that the hearing that we had opened a lot of questions that still remain unanswered on portions of the bill. And so given the nature of how this bill is running and because we are close to a deadline, I would ask my committee members to make a motion to move this bill out without a recommendation so that it can reach the deadline.
I would make a motion to move Senate Bill 441 out of committee without recommendation.
And I'll second.
Thank you so much. So we have a motion from Vice Chair Nguyen and a second from Senator Lang. Any discussions or questions on the motion? All right, all those in favor, please say aye. Aye. Any opposition? Motion's carried. That moves us to the next agenda item. We have Senate Bill 435. So just give me 1 second. I'm going to go ahead and open the hearing on Senate Bill 435. This bill revises provisions relating to Medicaid. With us, we have Director Whitley and Ms. Stacy Weeks. So please begin when you are ready.
Chairman Donate and members of the committee, my name is Richard Whitley. For the record, I serve as the Director of the Department of Health and Human Services. With me is Stacy Weeks, who serves as the Administrator for the Division of Healthcare, Finance, and Policy. And she's going to walk you through the bill, and then I'll walk you through the amendment.
Thank you, Director Whitley. Mr. Chair, committee member Stacy Weeks for the record, Division of Healthcare Financing and Policy. The bill as drafted corrects issues with state law currently that narrows the use of the provider tax to only those that pay the tax currently. Federal law and recent guidance strongly indicate that the current language could be viewed as violating the federal prohibition on holding providers paying the tax harmless, which basically means that we can't guarantee everyone paying the tax will get their money back. Otherwise, it would violate federal law and we would not be able to draw down federal Medicaid share. These language changes will help the state defend the legality of the design of this tax. Specifically, the change allows the division to share a portion of the revenue from this new assessment authorized under State Law 422.3794 with operators not subject to paying the tax, if such use is supported in the poll by most of the operators who will pay the assessment. Currently, the division is implementing a private hospital tax. I think many of you may know about this tax. We're hoping to implement this tax by no later than January 1, 2024, and it will be supporting and helping about 55 private hospitals in the state. It will create new supplemental payments, inpatient and outpatient, in addition to state-directed payments in our managed care program. This new provision, though, would allow the division to address the legality issues of the tax under federal law and the potential risk to existing public rural hospitals with respect to the current Medicaid program and payments. The risk I am referring to is the one that exists every time as a state we open up our Medicaid state plan. And for those of you who may not be familiar with the state plan, it's basically our contract with the federal government and our agreement about how we cover and pay for benefits in the state. For example, CMS has been known to tinker with or change existing provisions in our state plan every time we open up a section. They have that right. By adding a new UPL or supplemental payment for private hospitals, the state does risk changes to existing programs from CMS, many of which have been on the books for some time. I just checked before I came over, it's been about 6 years, and that's, we have to always remember there were different administrations in charge and different opinions at the federal level about how supplemental payments work. Although the risk is low that CMS could take such actions, the governor recommends adding this provision in statute to ensure the legality of this tax is permissible and that the public hospitals, especially our rural hospitals, are protected from any adverse indirect consequences related to this private hospital tax and new payment programs. Currently, just for context for members, our public rural hospitals receive about $11 million annually in supplemental payments. And as you guys all know, operating margins are tight for these hospitals, so we want to make sure that these payments are held harmless. And what this essentially would allow us to do is if something does change and these payments are reduced, we'd be able to use that assessment money to essentially cover their losses and help make sure that they did not experience any reduction in funding. I'm going to turn it over to Director Whitley to introduce the amendment for Senate Bill 435.
Thank you, Chair Donate and members of the committee. Richard Whitley for the record. So the amendment to this bill actually pulls 15% of what is collected out of the provider tax, and for two purposes. One is to fund the work that it will take to oversee this. And I will just say that historically, Medicaid has cut itself short when doing supplemental payments to actually adequately funding the staff to oversee programs and ensure that we are holding to the requirements of CMS and that we're building foundationally what we said we would do. So we need resource to do that. And then the second piece, the larger piece, is funding to address the behavioral health system shortfalls that we have in our state. Each year we spend approximately $95 million of Medicaid on hospital charges for people with serious mental illness. Much of that is in the emergency rooms. Much of that is a result of not having adequate services in the Medicaid network in the community. We estimate that about $30 million will be available, generated from this 15% tax, available to then match with CMS, with the feds, on adding additional services and raising rates in the area of behavioral health. The other issue that we're addressing with these funds are, you may be aware that in October of 2022, the state of Nevada was noticed by the Department of Justice that our children's behavioral health had a substantiated complaint in terms of not providing adequate community-based services that as I described earlier, many children were and were ending up in the emergency room or in institutions who could have received services upstream. So the intent of this, pulling out the 15%, would not only help us to oversee this or manage it, but also to add services that are currently deficient in our state in providing community-based behavioral health services. This will benefit both adults and children and reduce impact on the hospitals and the crisis services that are currently being provided in our emergency rooms. And so with that, I'm happy to answer any questions.
Thank you so much. Any questions from any committee members? Vice Chair Nguyen.
I have a question. I know that this, obviously, you're saying that this is needed in order to comply with federal requirements as you're going through this. I know that we have another provider tax with, I believe, our long-term care facilities. Do they already have this language in statute? Or is there something different about that process that doesn't require it and it's required here?
Mr. Chair, committee members, Senator Nguyen, or through you, Mr. Chair, to Senator Nguyen. No, it does not have that language, but it is a different tax structure, and we do have a waiver for that tax model.
My second question has to do with this 15% in administrative, administrative costs. How did you determine that 15% of the total revenue collected annually?
I'll take that. So that was actually from my recommendation, and that's in comparison to other states. You know, obviously, our state model is different because we don't have various state taxes that other structures do in other states, and so that was from my recommendation.
I guess my question is does that 15% administrative costs, I know that some of that goes into the increased premium taxes that you'll have to pay for the collection. Does that 15% give you enough to cover those increased premium costs? And what is the actual amount? I mean, if you can give me like some estimates to explain that.
Mr. Chair, committee members, Senator Nguyen, that's a very good question. So yes, we consider the impact of the premium tax, which applies to our managed care program. So all the payments that will come through the managed care program increase that size of that tax that we have to pay, which is paid out of our budget. We assume that that's about $29.5 million a year in cost, and we will be using about 11 to 12 million of the funding, the assessment, to draw down federal share to help pay for that fee that we'll be paying. And we consider that administrative fee to administer this program that we'll have to pay for.
So is that 15% enough? Because it sounds like you're trying to use that 15% to not only pay for the actual administrative costs, but also the increased taxes to cover that increased managed care costs. And then it looks like we also want to use that money to do some quality of care issues with psychiatric and behavioral health conditions. It seems like it's not quite enough money at this point.
For the record, Richard Whitley, we do estimate that it will be, and specifically the language in the bill says up to 15%. And so we don't have a spending plan to provide to you today. Our intention, of course, would be to go to IFC with what that spend would be. But it does look like, based on, we're trying to get several skips out of a single stone here. And so in addition to the benefit the hospitals get in a supplemental payment, hold the rural hospitals harmless, pay all of our taxes, administer the program, and then, as I said, about 30 million of unmatched, these would be held up for federal match that have flexibility to use with adding services or raising rates. As you've heard in other committees, our Medicaid rates are very low, and one reason we have provider shortages or willingness to provide services is because of the rates. So we ask for the flexibility in this so that we could come to IFC with a more detailed plan. Another challenge to us concurrently is we are negotiating with the Department of Justice, with the Attorney General's office, on the settlement on the agreement on services that we'll add for that Department of Justice substantiated complaint. So this is packed full of solutions, but we do believe, both Stacy and I believe that up to 15% is an adequate amount.
Thank you. I just had some concerns, and, I appreciate the chair, looking at industry standards. I know that what we are looking to do here with the hospitals is an incredible task, as well as, I don't think it's been done across the country to quite this level, especially since we have so many Medicaid, I guess, patients. Is that kind of my understanding here?
For the record, Richard Whitley, I think the supplemental payments to hospitals, there are lots. I mean, you mentioned your question, for the record, Richard Whitley, you mentioned it, or in a previous question about skilled nursing facilities. They're taxed, and that tax goes to general fund. There are lots of different ways supplemental payments are arrived at. This is a voluntary one. The statute exists allowing for the facilities, but it's the first time in our state. Statute's been on the books for some time, but the hospitals have come together. Other states do other interesting ways of collecting revenue that can be held up for a match. This one, though, as Administrator Weeks said, is different in so much as it requires volunteer participation. So that's what makes it challenging, is there has to be something in it for everyone, and to then leverage that to have an additional benefit to Medicaid. I think that's why we're hopeful that it will pass.
Are there any of those quality withholding measures included as a part of the CMS process, or are those things that are written out federally that we have to comply with and that the hospitals will have to comply with in order to even see these kind of matching dollars come back?
Mr. Chair, committee member, Stacy Weeks for the record. Senator, that's a good question. We still have to comply with the quality components for the state-directed payment portion. So yes, we're still in the process of putting that together. We are not currently looking at withholding any of the payment, given the situation with hospitals and the need for the funding. But in future years, if the legislature wanted to direct us to do that, or CMS strengthens their guidance, we could reconsider tying a portion of the payment to quality performance.
And then I'm sorry, Chair, is it okay? I'm sorry, I just have lots of questions. My other question has to do with the 67%. Obviously, this is a voluntary program that you have to have that 60% buy-in. Is that something, and it seems unclear to me in statute, whether or not that includes, sorry, I think that's my phone feedbacking, but I think are there any provisions, it seems like it's ambiguous, that do you have to constantly year by year be polling the hospitals to see if we're at 67%? It seems like a huge investment. And I know that we've already used some ARPA funds in the October IFC were allocated to kind of help start up some of this like process to allow them to apply. But are we going to put all this effort in and then every year we have to like hold our breaths to see whether or not the hospitals are polling at 67%?
Mr. Chair, committee members, no, we would be polling them this June is the goal, depending on, sorry, the mic's a little hot, depending on how, session goes and what would be in that poll, so we're waiting to see. But once that agreement is made, and that's how we consider it under state law, is that our agreement with them on how we're going to tax them, how we're going to use the funding. If we change any of that, yes, we would need to repoll them.
So just to clarify, right now, there isn't a way to look, if there, well, the argument if people like hospitals, they know that they're riding on tight margins a lot of times, but if they are profiting off of this like process that we're administrating as a state, are there any protections for the state to like curb that, or not really at this point?
Mr. Chair, committee members, no, there's nothing.
Thank you so much. Any other questions? Senator Titus.
Thank you, Mr. Chair. And more of a comment than a question. So I appreciate the Medicaid is such a convoluted system, and the reimbursement and our obligations and the match of the state with the match of the feds and the obligation and keeping us all out of trouble and making sure that we're following the line. I just want to acknowledge the effort that you folks have put into this, the amount of kind of out-of-the-box thinking, still keeping us safe and making sure that we can sustain some of this. And hopefully it moves forward, and I think you've done a good job explaining it. Thank you very much.
Vice Chair Nguyen.
I'm sorry. I know you guys can answer them though. With this amendment, you have the like some of the remaining monies collected by the division for administrative purposes that would be to improve access to behavioral health care services. And I know it's just kind of conceptually right here. How would you formulate that through the regulatory process to see what those measures looked like and how that potentially $30 million a year was reinvested into those kind of, I guess, services?
For the record, Richard Whitley, Director for Health and Human Services. Yes, as I said, we're working through the Department of Justice settlement, and the nice thing is the gaps they've identified are the gaps that our communities have provided or have identified, and our hospital emergency rooms have identified that services in the community that can keep people stabilized and can intervene early are the best place for those services. We know that we're missing for children and for some adults in-home services. So we know one service that we want to increase. The nice thing is Stacy Weeks has already identified the 90-10 match for that. So that 30 million that we estimate that might be available to hold up. And we know we have to raise rates. So that, and we're not prepared today to say which ones, but we do know that we have to look at that and see, we know the service is provided, but people aren't getting it. We know that there are service providers, but they're not providing it for Medicaid. Rates likely are the issue. So we will revisit that to see where we could make some significant immediate improvements in behavioral health. And again, take all that to the interim finance with that plan for approval for spending.
And of course, Ms. Weeks, she is a genius, and we are so lucky to have her in the state that she would immediately find a 90-10 match program for these kind of services. Would this be so limiting? I mean, I would love that we solve all of our problems, but let's say we're here in 6 years and we're like, oh, behavioral health is not a problem anymore. Would we have the flexibility to use these funds in another way, or is your intention just to use it that because it's so tied to that DOJ settlement?
Richard Whitley, for the record. As Administrator Weeks had mentioned, This is part of the polling. So this agreement, and why it is so specific, is the hospitals have to agree to participate in this. And so we would need to, if the legislature directed us to change how the funds are spent, we would have to, and maybe it's not a bad thing, re-engage the hospitals, see what's value, because this same provider fee or tax is available to other industries who are seeking rate increases. And so if it goes through, my hope would be that not this specific one, but perhaps other industries might take an interest and seek a provider fee or tax in order to receive supplemental payment. So the statute's already there, just hasn't been utilized.
Thank you.
Any other questions? All right, let's get the show on the road testimony. Anyone in support testimony, please come forward. As a reminder, folks, 2 minutes each. We'll start the timer, and we will begin here in Carson City and then go to Las Vegas. Ms. Hall.
Thank you, Chair Donate and members of the committee. We're enthusiastically in support of this bill. It obviously is a protective solution for public rural hospitals in Nevada for unintended consequences of the provider fee that is so important for the rest of the hospitals. The behavioral health component of it, we're also supportive of because obviously we have huge needs. Thank you.
Good afternoon, Chair and members of the Senate Health and Human Services Committee. Leah Case here today on behalf of the Children's Advocacy Alliance. As mentioned by Director Whitley on October 4, 2022, the U.S. Department of Justice released a report which found that Nevada unnecessarily institutionalizes children, sometimes out of state, away from their families and communities. The state responded with an investment of $43 million in ARPA funding to help stand up needed and crucial home and community services. But a sustained funding mechanism is still needed. The amendment to SB 435 starts this process. According to budget account 3177, this provider tax will bring in a total of $388.8 million annually. 15% of that will go to administering the program, with remaining funds left over for behavioral and psychiatric health. Nevada has a history of leaving mental and behavioral health behind or on a bus to another state. We support this first step while recognizing that there will still be a need for increased and sustainable funding to address the shortcomings noted in the DOJ report and to put Nevada on the right track for children's mental health. Thank you.
Good afternoon, Mr. Chairman, members of the committee. Jeanette Bells on behalf of the Nevada Psychiatric Association. Leah said it very well. The needs are great, and we are grateful that these dollars have the potential of assisting in that regard. Hopefully, as it was pointed out, there will be enough to spread around and address the mental health issues that we all face. Thank you.
Chair, members of the committee, Jonathan Norman, Nevada Coalition of Legal Service Providers. We represent about 3,000 to 4,000 kids in foster care at any given time. I won't belabor it because I think it's been said really well, and I appreciated the committee's questions, clarifying things. I appreciate Director Whitley and Ms. Weeks because I really think they've taken a look at something that could really help our community and our clients. So thank you.
Good afternoon, Chair Donati, members of the committee. Joanna Jacob on behalf of Clark County. Having worked over the last 18 months with legal aid, the state, and various stakeholders on our children's behavioral health crisis, we know and appreciate the need for sustainable funding to address the gaps that we identified, that actually helped to support the ARPA award over the summer, and that eventually the DOJ published in their report. So we wanted to thank Director Whitley, the governor's administration, everybody who's working on trying to address that issue, and we think this is a very good, sustainable way to fund the work that we started over the summer. So we are in support and very thankful for the work of the state to start to try and address some of these issues. Thank you very much.
Good afternoon, Mr. Chair and members of the committee. My name is Sarah Adler, here today for NAMI, National Alliance on Mental Illness Nevada. And Senator Wynn, we just love your dream. But as someone whose sister manifested with bipolar disorder 42 years ago, well, it's going to continue. But what is great is the activism of our State Department and our Medicaid director and the recognition of all of you of the need for funding streams so that we can turn safety nets into solid floors of support and maybe into gentle trampolines back into health. So thank you. We support this bill.
Thank you so much. Anyone else in Carson City? Let's go to Las Vegas.
Well, I just looked here and it says you've got 100% approval. That's pretty good. And I have to say, this has been a good day. I've seen
Name for the
you
record,
all
please.
Ma'am. You have brought a wonderful bill
Ma'am.
to the floor.
Ma'am.
Excuse me?
Name for the record.
Oh, I'm so sorry.
Yep.
Susan Prophet. I'm the vice president of the Nevada Republican Club.
Thank
And
you.
I like this bill a lot. And I'm excited about just about every bit of it. And I'm going to be looking forward to seeing how fast the cost of aspirin comes down at the hospitals. And so thank you very much for coming up with another bipartisan bill that we can all feel good about. Have a good day.
Thank you, ma'am. Anyone else in Las Vegas? BPS, is there anyone virtually?
Thank you, Chair. There are no callers at this time.
All right, let's move on to opposition. Anyone in Carson City? Anyone in Las Vegas? And anyone virtually?
Chair, there are no callers at this time.
Thank you so much. And then now let's move on to neutral testimony. Anyone in Carson City? Any in Las Vegas? And virtually.
Thank you, Chair. There are no callers at this time.
Thank you so much. Any closing remarks? Nope. All right, I'll entertain a motion from Vice Chair Wynn.
Do you want to close the hearing?
And I will close the hearing.
Thank you, Chair. I'd make a motion to amend and do pass and refer Senate Bill 435 to Finance.
Thank you so much. We have a second from Senator Titus. Any discussions, any questions? All those in favor, please say aye. Aye. Any opposition? Motion's carried, and I will take the floor statement. All right. That concludes this hearing and this bill presentation. We will move to the last agenda item, which is public comment. Is there anyone that would like to provide public comment at this time? No one in Carson City, anyone in Las Vegas, and anyone virtually.
Chair, the lines are open and working, but there are no callers at this time.
Thank you so much. All right, that concludes today's meeting. We'll see everyone next week on Tuesday. Meeting's adjourned.